Good morning, bonjour. Minister of Health, Honorable Dr. Jane Philpott, members of the Parliamentary Health Committee and members of the Senate Health Committee. I'm truly honored and grateful to present my research policy brief on improving the cardiovascular disease risk and treatment management in Canada. My name is Nick Mawani, and I'm the president of a non-profit organization called Organization for Research and Community Development Canada, Inc. And I'm also an online doctoral student in public health at Walden University, USA. I graduated from the University of Ottawa, not far from the Parliament buildings here in Ottawa, in biological sciences. Subsequently, I completed my internship as a registered respiratory therapist at the Royal Alexandra Hospital in Edmonton, Alberta. I went back to school in 2011 and earned my Master of Public Health degree from the University of Liverpool, United Kingdom, in 2014. I'm also a recipient of the Queen Elizabeth II Diamond Jubilee Medal for the promotion of healthcare and healthy living. The purpose of this presentation is to acquire political support and urgent action to adopt peer-reviewed evidence-based recommendations for further improving CVD health outcomes with improved long-term societal costs in an economically feasible manner in Canada. According to the Heart and Stroke Foundation 2016, 1 Canadian dies every 7 minutes, despite 75% improvement in CVD prevalence over the last 60 years. Furthermore, CVD is costing $20.9 billion to a national economy. The last political initiative to address the CVD challenge in Canada was initiated by the Federal Minister of Health in 2006, which is a decade ago. This initiative created the present Canadian Healthy Heart Strategy Action Plan, or CHHSAP, on which the current clinical guidelines are based within the Chronic Care Model, or CCM. Since then, new medical, epidemiological, and economic peer-reviewed evidence has emerged that will reduce CVD event risks by 33% in the next 3 years and CVD death risks by 50% over the next 10 years, with a total societal cost savings of $1,038 per patient if the naturopathic care was added to the existing CCM framework. Additionally, the medical and epidemiological evidence demonstrates rapid growth of the CVD high-risk South Asian population segment in Canada, specifically more so in the Greater Toronto area. Emerging peer-reviewed evidence shows that ethnically targeted and ethnically tailored CVD risk and treatment management will reduce CVD risks further and will reduce associated direct and indirect costs. Furthermore, current findings show that 10% of Canadians are unable to afford their cardiac medications that may endanger their lives if they're not assisted through targeted provisions. In conclusion, based on medical, epidemiological, and economic peer-reviewed evidence presented here, it would be ethical that the improvements recommended here be adopted urgently so that they can become part of the current chronic care model and become the new 2016 CVD policy of the Government of Canada, with demonstrated ability to improve CVD health outcomes and societal cost savings. Thank you all very much. Merci beaucoup.